Hi all, coming back with OBG after a long gap. Okay, so today's topic is Salphingitis. Salphingitis is coming under your unit 4. Okay, gynec. So what is Salphingitis? Salphingitis is the inflammation of the fallopian tubes. Now you might be thinking, see, once you go back to the reproductive system, there are two fallopian tubes, right and the left, and which is ending up with the fimbriae and the ovaries. So what happens? Either at the infection in the one side or in the both side. So epidemiology says that over 1 million females are getting affected every year. Okay, then the highest rate of this infection is in the reproductive age by 16 to 24 years. Okay, moving on to the etiology, the main cause is bacterial infection. Okay, it can be gonorrhea, streptococcus, staphylococcus, chlamydial infection. Okay, smoking mothers, overuse of tampons and chemical around the perineal area. Okay, endometrial biopsy, STDs. These are the usually this etiology can end up in Salphingitis. Okay, moving on to pathophysiology. See, the main infection is bacteria, is the origin is in the vagina. Okay, now when I say the pathophysiology, remember the structure, okay, of the reproductive system. Vagina, the bacteria is present. Okay, once the menstrual flow starts, cervix gets open and allows the bacteria to go through the lymph nodes from the urethra, not urethra, sorry, from the uterus to the fallopian tubes. Okay, thus the infection occurs and signs and symptoms occurs. Okay, I hope you understood the pathophysiology. I repeat, due to the etiological factor, the origin of bacteria differs or is present in the vagina. Okay, once the vagina gets open through the menstrual flow, what happens? Cervix is already dilated or it's open, right? Cervix get opened. Okay, cervix get open and the bacteria is allowed to move to the fallopian tube with the help of lymph vessels. Okay, then moving on to the clinical manifestation. Clinical manifestation, moving to before moving to the clinical manifestation, we have to see the types. There are two types of salpingitis: acute as well as chronic. Okay, so acute salpingitis is like it will be there for few weeks. Okay, in acute signs salpingitis, there will be redness, swollen of the fallopian tubes. That is the main symptoms of acute. Okay, so what happens, like when the redness and swelling occurs, this see, it's the tube of fallopian tube, right? This is a tube. One side it will be this much, other side it will be this much. Okay, so this tube, when it gets swollen and adhered, it become adhered. Okay, it become adhered and it become blocked, so that the ovaries is not able to travel as well as the sperm is not able to meet the ovary. Okay, there will be a blockage of the tube. A chronic salpingitis, which will be mild in the starting, but pain and all will be more in the severe stage, and repeated or repetitive attack of acute salpingitis leads up in chronic salpingitis. Okay, now other clinical manifestations are like abdominal pain, vaginal smell, odor, vaginal discharge, then pain during ovulation, pain during intercourse. Okay, then ectopic pregnancy, pain during intercourse I have said, and it is a bacterial infection, so usually there will be a fever, nausea, vomiting. Okay, and low back pain. Okay, so this was all about the clinical manifestation. Moving on to the diagnostic evaluation, histocollection, physical examination, perineal examination, vaginal examination will be done. Hysterosalpingogram. It is like an X-ray only, a special type of X-ray to visualize, okay, both uterus as well as the fallopian tube. Okay, then laparoscopy will be done in case of any infection and all. Then management, bacterial infection, antibiotic treatments will be given. Example, metronidazole can be given. It will be given through oral. Okay, for continuously 14 days. Okay, if it is what, a gonorrheal infection and all. Complications is like infertility. Like first, if it is an acute salpingitis, the first attempt only 8 to 10% of infertility can occur. Okay, then ovarian abscess, then infection of the sex partners, infection of the ovaries and uterus. Okay, ectopic pregnancy. Ectopic pregnancy, you know that the sperm and ovum is getting fertilized, okay, not in the uterus, in the fallopian tube. That is known as ectopic pregnancy. So I think we have finished with this salpingitis. If any doubts, please get back to me. Okay, small bishop salpingitis is the inflammation of the fallopian tubes. Okay, either one or the two. There are two types, acute and chronic. Okay, etiology, we can say it might be due to bacterial infection. Okay, then smoking mothers or endometrial biopsy, STDs. Okay, pathophysiology is like due to etiological factor. The main origin is in the vagina. Menstrual retrograde, menstrual flow opens the cervix. Bacteria enters through lymph vessel to the fallopian tubes. Okay. Clinical manifestations we have discussed. Management, antibiotic treatments will be given. Symptomatic treatments will be given. The main complication is infertility, ectopic pregnancy. Okay. I hope you all understood. Thank you. Have a nice day.